Summer's supposed to be the easy season. So why are so many people quietly Googling a therapist between summer Fridays? Because more daylight doesn't fix the hard stuff. Sometimes it just turns the volume up. Grow does therapy differently. Therapy is not only for when you're in crisis. Grow Therapy is here for all the moments when you decide you want more. More support, more clarity, more tools. Mental health isn't a destination you reach, it's something you build, and Grow makes that easier. Grow connects you with thousands of high-quality licensed therapists across the U.S., offering both virtual and in-person sessions, nights and weekends. You can search by what matters, like insurance, specialty, identity, or availability, and get started in as little as 2 days. There are no subscriptions, no long-term commitments. You just pay per session. Grow helps you find therapy on your time. The therapist you want takes your insurance on Grow. Grow accepts over 125 insurance plans. Sessions average $21 with insurance, and some pay as little as $0 depending on their plan. Visit growtherapy.com/booknow today to get started. That's growtherapy.com/booknow. growtherapy.com/booknow. Availability and coverage vary by state and insurance plan.
Welcome back to our Rebel Mind series. We're talking about mastering internal negativity during difficulty. And in this Rebel series, we'll explore concepts that help us understand our cognition so that we can take better care of ourselves and our patients. I'm Kim Bambach, and I'm an EM doc at The Ohio State University. I'm a med ed enthusiast and a curious human. Super excited to be here with you all. I am willing to bet that all the rebels out here are emotionally invested in their clinical performance and efficiency. We're all type A folks who want to be at the top of our game, and that means a lot of practice, whether it comes to procedures or managing patients in a high-stakes environment like the ED. But I want to talk about how to practice better. We've all heard that practice makes perfect, but it's not that simple. So practice makes permanent, and how we practice matters. So I'm here with Dr. Jennifer Yee, and she's going to be talking to us about mastery learning and deliberate practice. She's an associate program director here at Ohio State. She's a simulation director, national leader in simulation, and she's simulation trained. And she's honestly one of the most impressive clinicians and educators that I've ever had the opportunity to meet, and she's a very dear friend. Thank you so much, Jen, for joining us.
Thank you, Kim. Excited to be here.
So can you tell us, what is mastery learning for those who haven't heard the term before, and how is it different from traditional medical education?
All right. So I'm going to pose a hypothetical situation. So I think it's best understood in my brain with procedures. So when you're thinking of procedures that make you nervous as an EM doc, I'm thinking the really high acuity, low occurrence stuff like Blakemore's or other procedures such as transvenous pacing that we just don't get to do very often. So imagine if I told you, and I told your entire class of residents, we are going to get you from whatever baseline skills you currently have to you all are going to be high performers, and there's going to be just minimal variation between how you all practice. So essentially, you're all going to be able to do this, and you're going to become very objectively competent and hopefully more confident as well. So that is the basic framework behind mastery learning, is getting everybody to a really high level with a minimal variability. So a group of educators have really taken the concept of mastery learning and put it within medical education. And this includes Diane Wayne, Jeff Barsak, and William McGahee. So what the actual framework entails is first just getting baseline testing. So I will tell our interns during our procedural training and intern year, show me what you got. I don't care how you perform, but it really shows me, but more importantly, shows you exactly how you're doing so you can also assess your opportunities. Next, there are clear learning objectives or step-by-step procedures. Then you engage in deliberate practice. But on the other side, we're assessing you with a checklist that has a minimum passing standard or a passing score. The baseline as well as the final test has the same minimum passing standard that you work up to by engaging in that deliberate practice.
So we're used to thinking about training as time-bound, like after I do this training or this 3-year or 4-year EM residency, then I'm competent, or after I do X number of chest tubes, then I'm confident. What I'm hearing is this isn't time-bound. It is getting everybody to the same procedural standard using some sort of objective measure like a checklist.
Yes, so the difference between this and regular clinical practice is you really have everything laid out step by step and you know what the target is. And you engage in practice by breaking down things into individual steps until you get there guided by an expert or an educator.
Got it. So no more see one, do one, teach one.
Oh, yes. Old school thinking. Put that away, put it on the shelf. It's really something that has been debunked. And the exciting thing about mastery learning is it's one of the few educational frameworks that's actually been shown to improve patient care. A lot of things we do in medical education is theoretical, but that Northwestern group actually showed that by engaging in mastery learning for central lines, they were able to decrease the amount of needle passes, complications, and even improved healthcare savings for trainees that engaged in mastery learning for central line placement.
Yeah, that's awesome. That's awesome. So how did you become interested in mastery learning through your SIM background?
I am going to give a shout out to David Way, who is one of our medical education specialists, and he really encouraged me to attend this Northwestern workshop. Previously, I had gotten a little bit of a taste of this in my simulation fellowship, but I really became more familiar with the conceptual framework there.
Awesome. So let's talk a little bit more about deliberate practice and break that down. So in medicine, we often assume that experience alone leads to expertise, but not necessarily true. And we want to be clinicians who are true experts and fight the plateau or skill decay that we all know is going to happen if we don't keep up our skills, especially after residency. Deliberate practice might be the antidote, but how do you practice deliberately?
That is a great question. And Anders Ericsson actually is one of the forefathers of thinking about deliberate practice, but his initial research really became skewed because people would use his work to say, oh, you need X number of hours to really become good at something.
Like the 10,000 hours rule.
Absolutely. But other studies have shown that experience doesn't necessarily translate to competency, nor does confidence. So imagine on shift, many times we'll ask a medical student, do you feel comfortable sewing up that lac? And if they say yes, we say, go forth. Or do you feel comfortable doing that IND? But in reality, we are not accurate self-assessors, unfortunately.
That is unfortunate. And actually, in one of our previous Rebel Mind podcasts, we talked about the Dunning-Kruger effect, which unfortunately part of that effect is poor ability to accurately assess our own competence.
Yes. So the thought behind deliberate practice is it is purposeful practice plus an expert educator or coach helps guide you. And what purposeful practice is it's really learner-driven targeted improvement with feedback. So let's go back to central lines. It's an easy example to use. So if you are putting a needle into the skin and you are guiding it in towards that vessel, that is a micro skill. That's just a small part of central lines. But true deliberate practice is driven by the learner, where they say, you know what, I want to get better. I am internally driven to get better. So they say, I'm going to take this micro skill and I'm going to practice it. And deliberate practice says, let's do that, but with a educator or a coach that's helping guide you. So you're not just blindly doing the same thing over and over again and hoping for the same results.
Is there any way to engage in deliberate practice by yourself without that external person?
That leads a little bit more towards the purposeful practice. So it no longer, by the definition and by the book, is deliberate practice.
Got it. So when you're working with this expert, what is high quality feedback within deliberate practice? I think it's safe to assume it's not good job or read more.
Correct. So if you are watching somebody do a particular micro skill, say for procedures, Ideally, high quality feedback is something that the educator is observing. So they'll say, I am looking at your needle angle, or I am watching how you are holding the needle and pulling back the plunger for negative pressure. So something that you are observing versus assuming, and you can give that real-time feedback of, this is what I'm seeing, this is what I would do instead, and an explanation why. To say, you know what, if you angle up a little bit more steeply when you are entering the skin, you are therefore going to get into the vessel faster and it'll be a shorter course.
That makes sense. So you're really starting with that observation, something objective as you can be.
Absolutely. And sometimes it can be reinforcement of something you're doing well. Hey, when you're intubating, I really like your hand placement on that laryngoscope blade. I thought it really gave you more of an angle and more power to truly lift the mandible.
Perfect. We're going to be objective. We're going to be specific. We're going to help the learner target exactly what it is. And that's sort of the feedback that we're looking for when we're practicing as well. I know a lot of the listeners are thinking about how this applies to procedural competency, and we've talked about central lines, and you've spent a tremendous amount of time teaching procedures through SEM and mastery learning frameworks. What are the common mistakes that learners make when they're trying to improve procedural competence, and how can we practice procedures more effectively?
Yeah, so I think sometimes learners will see different procedures as a step 1, 2, and 3, especially depending on where you are in your medical education journey. So I try to challenge our trainees to really engage in adaptive expertise, meaning once you are more comfortable with the procedure, you start to think, okay, what if there's atypical anatomy? Or what if there's a complication that arises? Is there a way I could have predicted it, or a way I could have avoided it before it even happens? So to try to conceptualize the big picture versus, okay, I do this step because it follows this step, and I do this next because that is what a checklist or video tells me. So, for example, going back to central line, I am going to go ahead and I'm going to dilate the skin down to the vein so that way the triple lumen catheter will feed smoothly, but I'm also going to anticipate some bleeding. So I already have some gauze nearby that I can quickly use to hold pressure versus I have to do this step because it comes after the next step. And then I know the third step because that's what the video told me.
That makes sense. You're thinking critically about why you're doing what you're doing.
Mm-hmm. And anticipation.
Yeah, absolutely. I'm going to nerd out for a second. This reminds me of a German word. So long story short, I love German, the language, and my husband's from Germany, so big part of my life. But there are a lot of very specific German words for things, and one of them is mitdenken, and that means to think along with. There's no perfect English translation. Maybe being on the same wavelength is the closest, but you're thinking along with during the procedure exactly why you're doing what you're doing.
Yes, you are very much in the moment, but you're in the moment doing while you're also mentally also in the future a little bit ahead of time for the anticipatory steps.
Ooh, I love that. We need a new word for that.
Yes.
Perfect. So I can imagine that psychological safety is really important when you're teaching procedures or using the mastery learning framework. I can easily see how ego and identity might interfere with deliberate practice because you kind of have to be vulnerable to be constantly getting feedback and constantly looking for opportunities for growth. And, how do you manage that? How do you create environments where learners are willing to fail and willing to receive feedback without that shame and defensiveness?
100%. And I love that you introduced vulnerability, especially because with mastery learning, this is one-on-one education. And I tell everybody, this is awkward because you're having one of your new faculty members, like during orientation, just standing over you and watching you silently. So I think that's where the importance of the pre-brief really, really comes into play. So we try to lay it out immediately that this is all about patient safety. So ultimately, I try to think of something that we all can agree on is we want to deliver the best, safest care for our patients as we can. And everyone's going to say, of course,
Absolutely.
that is not anything that you can debate. That is a universal truth for all of us within medicine. So then I will recognize the tension, especially as you make that transition from undergraduate medical education to graduate medical education, from medical student to resident and even fellows and beyond. Whereas a medical student, you care so much about making sure that you are getting good shelf scores, you're passing your step 1, you're doing great on step 2, because that stuff matters to make sure that you get into the residency you want, the career you want. So you go from saying, I am externally motivated by high scores to suddenly saying, I need to be vulnerable and see how I can really examine my own opportunities and then be very deliberate about targeting those to strengthen up your skill set. So I'll recognize that verbally and I'll say, listen, we're in it for patient safety. We are going to go through a assessment that might feel awkward, but I say, you know what? You all have different baselines. You all have had different clinical experiences. Some people that we have coming in were already in the military and they're like, I have been in combat zones and I've done 300 chest tubes already. I said, great, more than I have done as an attendant.
Right.
Or they'll say, I trained during COVID and I wasn't able to do any intubation. So I am coming in a different level than any other medical student before me in recent times. And I say, that is
Great.
okay.
We got a baseline. Yeah.
Exactly. We are going to work with you. Our job is not to judge you. We are not talking about your score behind your back. We are saying, okay, let's work with you so you identify where you're at, and then we're going to coach you up, and you're all going to do great. You're all going to be high performers, and you're all going to have minimal variation from each other. So we are not going to be ranking you like who got 1, 2, or 3. We're not scoring you. Ultimately, this is to build you up because we're investing in you as physicians now in emergency medicine or in our practice. We care about you and we care about our patients.
That's wonderful. You know, I heard you use a term before that I wonder if you could expand upon. Sometimes it's difficult to learn a new skill and get to this point of competency. Can you tell us about the productive struggle?
Yes, absolutely. I love this concept. So I want to start off by saying psychological safety and a productive struggle on your medical education journey are not mutually exclusive. I think of them as related concepts. So productive struggle reflects the idea that in order to grow, you need to have a little bit of challenge or a little bit of struggle. You need to find where the boundaries of your knowledge, your skill set start to get a little bit hazy and say, perfect, I have found it out. Now I'm going to be intentional and I'm going to work at this very deliberately to keep getting better. So again, it's about being proactive. About finding out how you can continue to grow. But instead of avoiding struggle and saying, you know what, we want to make residency and training very easy and simple and no stress, and we want you to be well, well-being doesn't mean the avoidance of struggling.
Right.
Well-being says we are going to empower you with the tools that you need to make the most out of all the struggles and challenges that are inherent within medical education.
Perfect. And this reminds me of that graph where the center of the circle is comfort, your comfort zone, where there's not much growth. And then the very outside part of the circle is where you're unsafe. The clinical demands are too much for your current skills, but kind of that middle sweet spot is the zone of proximal development. That sounds like that's where productive struggle should happen.
An example on shift is sometimes I will ask our residents, I'll be like, how are you feeling? And they'll say, you know what? I have so many sick patients. I have a high volume. And I'll say, are you a little bit uncomfortable? And they'll say, yes. I'll say, great. That's where growth is going to happen. Let's try to pick up one more chart and try to see if you can see them. And I am here to help you. And please delegate anything to me. But let's try to push that a little bit more. And on the next shift, you'll be able to more easily pick up that one more patient and then just keep going.
I love hearing you talk about it because just thinking about my experience, with you as my attending when I was in residency, and now as a faculty member, seeing how you interact with residents, I feel like you're so great at pushing people just the right amount, and we can all learn from that. I want to talk specifically about how we can apply this practically. So, a lot of the listeners might be residents, and a lot of these concepts are especially salient in this really intense period of life. But, there are also seasoned attendings listening, and even the most seasoned probably have procedures they haven't done in a while. If you're doing a lateral canthotomy or a transvenous pacer every day, that's pretty strange. I would maybe question the indications of how that's happening. But how can we apply the principles of mastery learning to maintain high level proficiency with those halo procedures? Whether you have access to a sim lab or not.
I will tell you, I'm a late adapter to watching The Pit. And I am watching it with my husband.
Awesome.
And as we watch multiple times an episode, I'll say, have yet to do that. 10 years into my practice, have yet to do that. But if it comes up, I would feel comfortable being able to do it in real time.
Right.
And I recognized coming out of residency and fellowship that sometimes I was like, you know what? Blakemore being another example, I said, at the time, like mentally running through that checklist at the grocery store, I said, I still have room to grow. So I sat down and I was like, I am going to make my own checklist and say, all right, let's line up every step that I need. And to really add mastery would just say, all right, what is a passing score? And how we often will do that is a method called the mastery angoff, where we say, what do you expect a well-prepared either resident or physician, how do you expect them to do each step? So the mastery angoff sets a standard or a passing score where you say, how would you expect a well-prepared physician to perform? So that takes it from a regular checklist to truly saying mastery, because you have that standard, and then I am going to be internally driven to practice this, and then with a coach or someone else who is more familiar with the procedure, I'm going to keep practicing it in micro steps until I hit that standard. So that goes from reviewing to a typical procedure lab to really adapting the mastery framework.
So there is a lot of value in even beyond residency if you have access to sim space to practice some of these things, even with a peer.
Yeah, and I know we've been talking a lot about procedures, but there's a lot of other skills that are not necessarily as psychomotor, including breaking bad news.
Right. We do this with our residents and run these cases.
Yeah, and that requires very little physical resources. You can practice with a friend, you can practice with a peer, but that is arguably just as important, if not more important, to our patients sometimes to say, how do we appropriately communicate different scenarios and different information?
Wonderful. So not just the procedural skills, this can really be applied to a broad range of skills.
Absolutely. And I think what's fascinating too is the Northwestern group doesn't even stop at just practicing this with trainees. They have also used mastery learning to teach patients' families how to take care of LVADs once they go home.
Oh, wow.
And they put them through a checklist and they say, let's practice until you hit that minimum passing score.
That is so cool.
Mm-hmm.
That is so cool. And for that patient population, I am sure that is extremely valuable.
Oh, absolutely.
Are there any other practical ways that we can apply the principles underlying deliberate practice in our everyday clinical work, so outside of the sim lab?
I think the big picture things would be to identify what you yourself need to work on, because deliberate practice is driven by your own innate desire to get better, and then finding someone that can coach you through it. So whatever skill, talent, ability that might be.
Perfect. It seems like more departments are embracing this concept. As we look to the future, what excites you the most about what's up and coming in simulation and mastery learning?
I think just in general, one thing I love about emergency medicine is we are continuing to evolve and adapt. Of course, we're looking at AI and dictation, but it's a wonderful opportunity for us to stop and look and say, what competencies are not traditionally covered by our usual assessment practices, whether it's end of shift evaluations, simulation, procedure labs, and say, okay, how can we break it down into skills, create a target or a passing score, and keep practicing it? The world's our oyster, and we're going to continue to evolve. Our standards are going to keep changing, but I think this framework really allows us to have a scaffolding of how we can continue to aim towards bettering ourselves for our patients.
Wonderful. Well, thank you, Jen, for discussing mastery learning and deliberate practice with us. My challenge for our listeners is, what are you going to practice next? Thank you, everybody, for joining us here on Rebelcast.